Okay, if you've had a tooth knocked out, this is pretty rare. I see maybe 2 or 3 of them a year. You can indeed put them back in place. That's what I always recommend. Just suck it off, suck the root off with your mouth and spit, obviously, if there's like dirt on or whatever, just eat it like a man, suck it, spit everything out, hold the tooth, plant it back in and hold it there with anything soft. You wanna bite on something soft, just to hold it in place, okay? If you have some gauze, if you need to, just get some, I mean, it sounds gross, but like a sock or some kind of cotton or a napkin, that would be really great. Put a napkin in there if you got it, and then come in and see me. And what we'll do is we will splint the tooth. I'll put 2 fillings in between that broken tooth and the 2 teeth next to it to hold it in place. And our goal is for the tissue up in the socket to reattach to the root of the tooth, which can be done. Now, the tooth is dead, okay? Once the tooth comes out, you've basically severed the life of the tooth, but the inside of the socket has stem cells, and in those stem cells gives you the ability to reattach. So the tooth may reattach, but it will die. Now, what does that mean? That really doesn't mean much except for the color of the tooth. The tooth will, over time, turn brown, okay? Now, there's several things we can do. We can do a root canal, and we can bleach it from inside the tooth to turn it white again, and or we can just put a veneer over the front of the tooth, which is like a covering for the tooth. It looks just like the tooth did before, except now it's white, right? But the tooth is still in place, and it's fixed, and it's permanent again. It's just dead on the inside. So kind of a fun fact there, right? So once again, by way of review here, if you have the tooth knocked out, okay, hurry, put it in your mouth, suck all whatever grime, you know, if it fell in dirt or whatever it is, grass or whatever it is, clean it off with your mouth saliva. We want the bacteria in your mouth. Clean it out, suck it a little bit, you know, spit out whatever crap, you know, you got on that tooth, and then put it back in place. Hold it there, bite on something, or hold it yourself if you have to. I prefer you just to kind of bite into it. Keep it there, right? Come in right away. You don't even need to set an appointment. Just like come right in, right? Say, hey, I just knocked my tooth out, and we'll take good care of you. It's 19 bucks. We'll do the exam, x-rays, and I'll splint that tooth back in place. Obviously, we'll do some follow-up with you after, you know, a couple weeks and then maybe a couple months, just to make sure that everything is integrating again, and then we'll go from there.